Good morning. All right, thank you. We are celebrating 2024 as the year of GaHIN, and you are all here at our celebration today. And we are congratulating ourselves for being one of the most, not one of the most innovative and pioneering HIEs in the nation. And we are using InterSystems and ready computing to do this. So let's go to it. Those of you who are not familiar with GaHIN, let me tell you a little bit about us. We were formed in 2013 with the AURA high-tech funding, and we have 3 products in our portfolio. The first product is direct messaging, Georgia Direct. We were the first HIE, one of the first HIEs on Direct Trust, and we knew we needed a product that could meet our providers who had not adopted advanced EHR. They needed a way to still exchange health information, so we implemented direct messaging. We move roughly 1.2 million messages per year using secure messaging. Georgia Connect. That is our query-based exchange product, and we roughly move 22 million documents per year, 19 million patient queries. And because we're InterSystems, we use the eHealth exchange, and we retrieve roughly 3 million messages from the eHealth exchange, and we respond to 11 million queries into GaHIN using the eHealth exchange, as InterSystems is also the backbone for the national network. We also have close to 100 million admission, discharge, and transfer messages, and we provide 25 million alerts per year. So we are a well-adopted HIE. Our most current product is Georgia Unify, our social referral integrated platform that you're going to hear much about today. So we are an advanced HIE, very excited about what we're doing in our space. Next, when we were beginning to form GaHIN, we knew we had to be prepared to move beyond just exchanging healthcare data with traditional healthcare providers. In our year of 2024, we believe our technical infrastructure that we now have in place allows us to reach the full vision of what we believe an HIE should be. So let me talk a little bit about what our platform looks like using HealthShare. We are able to bring in large amounts of clinical data, as I've already described, admissions, discharge, and transfer information. But we are also able to work with our state agencies who manage massive amounts of data for our state. We have the ability to bring in non-formatted, standardized data into our repository, format it, and then move it as appropriate. And we do this for claims data, immunization data. Then we can match it up with ADT data. We can bring in historical lab results and data there. We also bring in telehealth data. But most recently, we've added social determinants of health data. We believe that we are the first, if not only, health information exchange network in the nation connected to our state agency for housing. We are now bringing housing data into our clinical data repository and making a match across the records for our healthcare providers. One of my favorite features on this platform is the ability to create cohorts. If you're not familiar with that, a cohort takes the burden off of providers to have to search through tons of data to find liked patients. So if they need to know patients with specific diagnoses or zip codes or conditions, we can format and create a space on our repository for those providers to log directly into the cohort and see that information. So the first use case I'm going to describe to you is one of our advanced interoperability use cases. is called the red blood cell, I have to read this, the red blood cell antibody data sharing initiative. We believe this is one of the most clinically critical use cases that we have encountered. What happens is patients with red blood cell diseases, and we'll use sickle cell in this instance, their health information is not required to be captured in the lab systems, and it's not formatted in most cases, it's free text. We all are aware that if data is not formatted, it's difficult to exchange it, and sometimes it's not even entered. If it's not entered, it's difficult, clearly, to exchange it. So we are working to help resolve these issues with health information exchange using GaHIN. So knowing a patient's antibody history prior to transfusion will decrease the unnecessary and avoidable risk of transfusion reactions and associated morbidity and mortality. That's a very serious statement by our providers. So this is what we are doing. We are working on the front end with blood banks and very passionate physicians who run blood banks in the Atlanta area to begin to work with other blood banks in our state to ask them to format data so that we can get it into the electronic health record in standardized use cases, so we can then move it over to GaHIN. If we can do that, we can minimize the risk of transfusion reactions. We're also putting together, working with HHS and these passionate physicians to create a white paper that will be available nationally. If we can do this, we believe, and we've already started the work, that we will save lives. So this is how the workflow is working. Patient presents at provider 1. Health data is entered into GaHIN in a standardized format. We are able to capture it and move those lab results into the blood bank cohort. The cohort will allow us to attach ADT alerts or messages to that patient. And when the next person on the other side, the next provider, logs into GaHIN and queries for health information, there's an alert attached to that patient that says, hey, I have sickle cell. In that cohort, those assigned providers can now work with the patient, exchange information, and provide critical content back to the providers to let them know to help save this person's life. Included with this work is the eHealth Exchange. We, not only in Georgia, have a high population of sickle cell patients, but Alabama does too. We are able to exchange health information with patients in Birmingham using the eHealth Exchange and participate in national research centers. The American Red Cross, very interested in working with us because they manage blood transfusions and transfer of blood. They're interested in providing us data, and they are interested in seeing the clinical record so they can participate in the care of that patient. The FDA is also working with us as they regulate treatments, equipment, and also have some pilot projects going on. So this is our new project, which is advanced. We are very proud of it. And to be recognized by the eHealth Exchange, we awarded the public health use case for studying using the GHIN for the work that we are doing here. Our public health agency will also use this data with their sickle cell projects. So again, innovative and pioneering. Our next use case we're going to look into starts to talk about our social referrals project called Georgia Unified. Now we're going to talk about how pioneering we are with closed loop referrals and whole person care. Georgia Unified. I'll just give you a second to look at the types of providers that now, or community-based organizations that now have access to GaHIN. You'll see correctional facilities, social care organizations, housing agencies now have access to GaHIN. If you can recall, we talked about, in many instances, health data being 20% of a person's health record. This is the other part. These providers and community-based organizations are giving us the rest of the health record. This is what we look like today in 2024, not 2026, today, 2024. We now, on this left side, we talked about providers having access to GHIN using Georgia Connects. So they enter our platform on the clinical side. There's no change in their workflow to get the social care data and information. This side of the house is our social care platform, Georgia Unified, created by Ready Computing, known as Channels 360. Our community service organizations who are not authorized to see clinical information enter GHIN on this side. What we have now in the middle is a platform that can bring in data from both sides, manage and match it, and make it available to authorized users based on their roles. What we are doing now, whole person care management, managing a whole person care record. Innovative and pioneering. Now, the capabilities of Georgia Unified, social risk screenings. In order to find out what a person needs, you got to start screening and asking questions. Resource directories. I talked about having access to housing data. That same state agency is giving us the resource directory for housing services. Reports and analytics. Imagine being able to tell a patient where services are available, how to find them, and reminding ourselves if they're showing up and what services are still needed. And then closed loop referrals and longitudinal person records. We just talked about those things. I have a live example for you. Community-based organizations. Our community service board organizations are the outpatient facilities for behavioral health. On the clinical side, we've already tackled connecting our inpatient behavioral health facilities. They're on the clinical side. When a person is discharged from the behavioral health state hospital, they are referred to an outpatient facility called a community service board. We have 26 of those in our state. What we are doing now is connecting them to the clinical side because they're clinicians. They'll enter on the clinical side. They will then have the ability, they have the ability now to log into or query over into Georgia Unified. We've built their service offerings, their community assessments, their social assessments into Georgia Unified. So as that patient sits there, has been discharged from a behavioral health hospital or being released from a correctional facility, they are there at the community service board to get help and reacclimated into society to prevent them from being readmitted or becoming a repeat offender. That's how important these community service board organizations are. And we've built their workflow to make it electronic so they can do referrals without having to wait on phone calls and faxes. Innovative and pioneering. We are also awarded, on a national level, a technical assistance project from a national organization called the Social Justice Conference. They want us to continue this work not only for the community service boards, but they want to make sure the Department of Corrections is connected, the Community Services Assessment Division is connected, and all of the behavioral health justice organizations in the state of Georgia, they want to make sure are connected to GHIN, and they are willing to work with us on this. If that wasn't enough for you to understand why we're celebrating and why 2024 is the year of GHIN, this slide is going to do it for you. All right, bear with me because we're going to talk about Tina, the patient. Tina is going to go to Grady Health System, a large health system in the state of Georgia, to get service. What happens with Tina is, at Grady, they can go ahead and query GHIN for her health information, and then she can show up and get her procedure done. What they're going to do after that is send her discharge information back through GHIN, and all of that is available. While Tina is still there, they're going to do an assessment using Georgia Unify. So Georgia connects, Georgia Unify, and they find out that Tina does not have health insurance and she is financially challenged. They're going to refer her to Mercy Care. They can do this all in GHIN. They refer her to Mercy Care. Mercy Care receives a notification through Georgia Unify and schedules Tina to come in to get vouchers and service. Tina shows up at Mercy Care. Mercy Care is able to query GHIN to get her clinical information from Grady to know what's going on with her, and then they sit down and do another assessment to see what other services Tina might need. They find out that she needs temporary housing. They refer Tina to Hope Atlanta, which is another community-based organization. Hope Atlanta can log into GHIN using Georgia Unify and see that a referral has been sent to them. Mercy Care can close out the referral because they can also see in Georgia Unify that Hope Atlanta accepted the referral. Hope Atlanta sees a referral, Tina shows up, and they realize that they also need to get support from the housing agency to get vouchers for Tina for housing. The referral is then made again to Partners for Home to get housing services. Partners for Home, Mercy Care, Hope Atlanta, and Grady are all working this same referral to help Tina get all the services she needs to be better in her care. Grady, as the healthcare provider, can now see everything that has happened with Tina. They can see what happened before she came to Grady. They can see what they did at Grady. They can see every referral that Tina attended, every referral that was made, closed, and managed. This is what we're talking about when we say closing the loop with patient care. This is what we're talking about when we're saying whole person care and having a whole person care record. Again, what are my two words? Innovative and pioneering. And we are extremely proud of what we're doing in 2024. And we, again, are congratulating ourselves for being one of the most innovative and pioneering HIEs. And we're thankful to InterSystems and Ready Computing for all the technology infrastructure they are supporting us with. So with that, I say thank you very much and enjoy the rest of the conference.